Okay, great. Good morning, everyone. Exactly 1 year ago today, the San Diego County Board of Supervisors threw its support behind Proposition 1 and called on voters to prioritize treatment over tents. This was not a popular decision. Prop 1 passed statewide by less than half a percentage point, and asking our board to take this risk was not easy. But I pushed for it because I knew this funding would be critical to expanding our work tackling our behavioral health crisis. So today, I'm proud to stand with our incredible partners and regional providers to announce how we're fighting to get San Diego County its fair share of Proposition 1 funding. Although we've made enormous progress over the past 4 years, San Diego County is still grappling with the behavioral health crisis that we inherited. For decades, California's mental health care system suffered from severe disinvestment, beginning with Ronald Reagan in the 1970s. By the early 2000s, public resources had been decimated, leaving communities with growing challenges: mental health struggles, substance use issues, and homelessness. We see this everywhere, from classrooms to living rooms to people on our streets with no rooms at all. But today, we stand at a turning point. Proposition 1 gives us a rare chance to rebuild and expand behavioral health care, to close the gaps, support our most vulnerable, and make sure no one is left behind. The challenges we face are enormous, but we've already made real progress. Since I joined the board in 2021, San Diego County has taken bold steps to invest in behavioral health care. We've increased our behavioral health budget by over $300 million, a 40% jump, the highest ever. And we've added hundreds of full-time behavioral health workers who are in our communities every day, providing care and helping out our neighbors on a path to healing. These investments have expanded access to care, improved services, and built a strong foundation for the future. So today, I'm excited to share our next step in this journey as we fight for our fair share of Proposition 1 funding. The county and our partners have together submitted funding requests for a total of 31 projects. 31 projects representing over $580 million in proposed infrastructure investments. Together, these projects would add 4,000 net new behavioral health beds across San Diego County. If we succeed in securing this Proposition 1 funding, these beds and services will save lives, provide critical care, and tackle the root causes of the crisis we see in our neighborhoods every day. So this team effort by our county and our regional providers, our partners in this work, shows what's possible when we work together towards a common goal. So to talk more about the important work underway and the strategy behind these funding requests, I'd like to introduce our Director of Behavioral Health Services for San Diego County, Dr. Luke Bergman.
Hi, everybody. Thank you so much, Vice Chair, for your leadership here and in and around behavioral health issues generally. I want to talk about three things reflected in this moment, in this gathering, in this effort. And those are partnership, diversity, and community. Partnership. No single entity, governmental or otherwise, can build the behavioral health system we need. Not alone. It's only something we can do together, with government and insurance companies, hospitals and community-based providers, counties and cities all working together, each playing their part, doing what they're best equipped to do with fidelity to what we all know works best and is most important. Diversity. The notion of diversity is under fire right now, as many of you are probably aware, but diversity isn't frivolous. In behavioral health, diversity is a bedrock requirement for our system of care. There is no single uniform pathway to behavioral health recovery. Rather, recovery is always a journey shaped by individual needs and community identities. Everyone needs individualized treatment that is responsive to their particular histories, traumas, and symptoms. We need a system that reflects that diversity of need. We need diversity of approaches, of clinical practices, maybe most critically of workforce, to make a system that works for everyone. In short, we need some of the diversity that you see right here among those who are gathered behind me. Across areas of clinical work, across our county's varied regions and geography, and across communities of identity. Speaking of community, I just want to amplify today's call to action, which is that we need all people living in this county to embrace the significance of behavioral health for everyone. Our children, our family members and loved ones, and our neighbors. One of the challenges that we face is convincing leaders across our county to embrace behavioral health resources in their own communities, in their own neighborhoods. Settings for behavioral health care are not liabilities. They're assets. They make communities stronger, healthier, and better. And I am so grateful for the partnership of those who are gathered behind me today. They have stepped forward, enterprising each in their own way, working in ways consistent with the county's priorities, with the state's priorities across levels of care for mental health and for substance use disorder. It is a very proud moment for the community of people working in behavioral health here in San Diego County. Thank you so much. I'll hand it back to Vice Chair.
Thank you very much, Dr. Bergman. Our next speaker is one of the dedicated providers working to transform behavioral health care in San Diego County. Dr. Cheryl Rode is the CEO of the San Diego Center for Children, an organization that has been a cornerstone for children's mental health in our community. Her leadership and her team's innovative approach to care are great examples of the partnerships driving real change in our region. Please welcome Dr. Cheryl Rode.
Thank you, Supervisor, and thank you everyone for being here today for this cause. I'm really proud to be here to represent San Diego Center for Children. We have been a partner in this community for 138 years, supporting children, youth, and families to live whole and healthy, joyful lives. We have been a dedicated contractor and partner with the County Behavioral Health Services, our Department of Child and Family Wellbeing, and our County Department of Education for decades. We believe that access to behavioral health care has become too complicated for families regardless of their health plan providers. And we know that fewer than 50% of children who need access to our services are able to receive that care. We also firmly believe that when we as a community put forth resources to go upstream and to provide early and effective services for youth and families, we can greatly reduce the risk for later serious behavioral health and well-being of our community. Our families need timely access to care, not wait lists, and not being told, sorry, we don't provide that service. The BCHIP Prop 1 funding creates a generational opportunity for us to come together as a community and increase our capacity and access to care. We are incredibly grateful to our partners at County Behavioral Health and the Board of Supervisors for supporting these efforts amongst our partners. For San Diego Center for Children, we have envisioned a children's community mental health center that includes clinic-based, community-based, and school-based services so that families can receive the care that they need, when they need it, and where they need it. We believe in a no wrong door philosophy that helps families to quickly identify what resources are available to help them meet their needs and to connect them to those services. As Dr. Bergman said, we can't do this work alone. We are part of a much greater community, And we believe that it is through that collaboration and partnership that we best meet the needs of families in our community. This facility, as we've proposed, would be located on our 12-acre campus in Linda Vista, where we also provide intensive behavioral health and special education services, with the goal of making those services accessible and fluid for families as they move across a continuum of needs. Finally, this new clinic also envisions a very advanced training center to help grow our behavioral health workforce. We know that we have a crisis of adequate workforce, and everybody in our community needs to partner to help us to build out that workforce and to sustain that workforce into the future. So again, I really want to express my gratitude and appreciation for our county and all the support as we move forward with this project. Thank you so much.
Thank you very much. It's now my honor to introduce Thomas Gerbala, the Operations Director for Generations Healthcare. Generations Healthcare provides skilled nursing and substance use treatment services, helping some of those vulnerable people in our community. Thomas and his team are focused on improving outcomes and expanding access to care, and their work is a key part of the Prop 1 vision. Please join me in welcoming Thomas Gerbala.
Thank you, everybody. Hello. I'm not a doctor, so I'll leave that out. But we're a proud California company, Generations Healthcare. We started 26 years ago in San Diego. We have a majority of our facilities in San Diego. We have 3,500 beds and 5,500 employees. 750 of those beds are in behavioral health. And we want to grow that platform. And this event today is fabulous. And I want to thank you for putting it together, Acting Chair. Without these partnerships and without the partnership of Luke, Dr. Bergman, there's no way that this could happen. You know, we could have all the money we can have, but without these partnerships, it's not going to happen. We've applied for a B-CHIP application in El Cajon at our Bradley Court facility. Now, we've gone through 3 years of planning and permitting, where we're at a point where at the end of next month, we're in our final planning session for our permits. All the other projects that are under B-CHIP are in the mid phase or whatever. So if we could have any support from the county planning department or building department, that would be huge. But we've already gone through those ILWELs, and I'm hope to be under construction this summer at our Bradley Court expansion. That will add 31 more behavioral health beds to our special treatment program, and it'll add a 66-bed substance abuse facility, which will be one of the first of its kind in California. It'll be a locked substance abuse community. It'll handle the new population that's going to be coming out in January of 26. Some of you may have heard of SB 43. SB 43 is coming out at January 26, and there's bed needs in that area. So we are hoping to be the company that could provide those. So I just want to thank everybody here and thank the county. Without the support of Hannah, Nalani, Luke, we would not be able to do what we're doing. And we have just opened up 58 new beds at Lakeside Special Care Center. That's run by Jamie Bays. And if anybody wants to tour or visit that site, it's a brand new built behavioral health facility. It's one of the first of its kind in the state. Come on by, we'll be happy to show you. But thank you very much, and I appreciate all the support.
Thank you. Our final speaker brings a vital perspective to today's conversation. Chairman Robert Smith of the Paula Band of Mission Indians has been a tireless advocate for addressing the unique challenges faced by underserved communities, especially in accessing mental health and addiction care. So please join me in welcoming Chairman Robert Smith.
Thank you. It's a pleasure to be here on behalf of one of the sovereign nations in San Diego County. There's 18 of us. We're applicant, and we want to serve all our natives in the northern San Diego County. We've got about 15,000 registered Native Americans at our clinic, which we partner with 8 tribes. But again, we look forward to working with the county in partnership because mental health is everywhere. So let's all work together and try to accomplish this goal. Thank you.
So as I said at the outset, with our Proposition 1 applications, we have the opportunity to open 31 new projects, bringing $580 million new dollars to San Diego County and adding 4,000 net new behavioral health beds. These investments would save lives, expand access to critical care, and address some of the root causes of the crises we see every day. But the fact is that securing this funding is just one step. We also need our local cities and our mayors to partner with us on this work, to clear hurdles, to approve permits, and to make sure that these projects actually get built and move forward without delay. This is a defining moment for our community, and together we can seize the opportunity to build a stronger, healthier future for everyone in San Diego County. So that's why this is something I'm asking everyone to support today. I'm asking every resident to join our effort by signing on to a letter that we'll be delivering to mayors and city council members in areas with proposed projects. The message is simple: partner with us, get ready, and when the funding is approved, get moving. My team is circulating the sign-on letter now, and we need your help to share it far and wide. The county is fighting, the providers are fighting, and now I call on you to also join us on this fight. If there are any questions, I'm happy to answer them. I'd also encourage our media to ask questions in one-on-ones with all of our providers who have joined us today. Those are the boots on the ground, and they can share their personal experiences dealing with the communities that we seek to serve with this work. Thank you.